2 hours before the Democratic debate last Sunday, Bernie Sanders released a detailed plan about his health care plans. And during the debate itself, Hillary Clinton didn't touch on it very much because, I mean, come on, he released it 2 hours before the debate, so how much review can she do? But luckily for us, we have the details and we're going to give them to you. Bernie Sanders basically wants to create a system where we have Medicare for all. It's a single-payer system that would make sure that every American in this country has access to health care. They will not have to worry about the cost of it because it will be paid for through taxes, okay? So Hillary did touch on that a little bit, and of course, red flags start waving as soon as a candidate starts talking about raising taxes. But let's give you the details of how it would work, and then you can decide whether or not you're in favor of it. Now, Sanders' campaign said that his system would provide health care coverage to all Americans. I like this part. Eliminate co-pays and deductibles and bring health care spending under control. That sounds pretty ambitious. How would it work? Universal health care is an idea that has been supported in the United States by Democratic presidents going back to Franklin Roosevelt and Harry Truman. That's a statement from Bernie Sanders. It is time for our country to join every other major industrialized nation on earth and guarantee health care to all citizens as a right, not a privilege. So let's stop there for a second. Interesting that in the United States, owning a gun is considered a right, but having health care coverage is considered a privilege.
Right.
That's the country we're living in right now. So
the only way to stop West Nile virus is with a gun.
His campaign said the plan would cost $1.38 trillion a year, but would save $6 trillion over the next decade compared to the current healthcare system. And they cited analysis by Gerald Friedman, an economist at the University of Massachusetts at Amherst. Now, much of the cost would be paid for through a 6.2% payroll tax paid by employers and a 2.2% healthcare premium on workers. It also relies on taxing capital gains, I like that, and dividends on families earning more than $250,000 a year, eliminate deductions for wealthy Americans, and raise the estate tax. So much of the burden will be on the wealthy. However, the middle class would pay an additional 2.2% in taxes in order to ensure that they have health care. Now, keep in mind, that sounds crazy. Like, I don't want to raise my taxes by 2.2%. That sounds terrible. But you would save so much money when it comes to your medical bills. I recently told a story about how I went to the doctor because of a health scare. Screening indicated that I had precancerous cells, okay? I went to do further testing just to ensure that I was safe and nothing was going on. And I had to pay $700 out of pocket during the doctor's visit and then got billed an additional $419 because of the labs.
Yeah.
Look, we're all paying too much money for health care. This is what happened to me under the Affordable Care Act. I have a PPO. I shouldn't have to deal with those kinds of costs.
That's a lot of money, yeah.
Yeah, so.
Yeah, I obviously, I think, I have to say this because if you say anything against Bernie, even secondhand, people are like, you fucking Hillary supporter. I support Bernie Sanders, but let's keep it real. You're not going to be paying 2.2% more. You're going to be paying some portion, perhaps all of that 6.2% payroll tax. Probably not the whole thing, but at least a portion of it is going to be passed on to the workers, so you'll be paying more. But you will still, at the end of the day, end up saving for an average family thousands of dollars every single year.
Absolutely.
And that is a bit confusing to explain to people that taxes going up still means you'll be saving money. But so far he's been focusing on the $5,000 for a family thing, and I think that he needs to. People need to understand that there's, for most families, there's nothing larger as an individual cost than health insurance, maybe your rent or mortgage payments or something like that. But health insurance is right up there, and eliminating a significant portion of that, that will, for regular people, more than make up for the additional taxes, even if the wealthy under this are going to be paying more. But they can console themselves with the fact that they make more than $10 million a year.
Yeah, but how's he going to pay for it? That's what people say.
90%.
No matter what you say, they're just going to say no matter. And that's what I love that whole thing about, oh, free college, free healthcare, how are you going to pay for it? Well, someone's paying for it now.
Yeah.
Right? So who's paying for college now? And by the way, college, not that expensive in the sense of if you look at, we just spent $30 billion for all the bombs we want to drop next year in the Middle East. It would cost $60 billion to send everybody in the United States to college. So it's very affordable. People have to keep drumming this into their heads. We're the richest country the face of the earth has ever seen. We've got more money than we know what to do with. We have an economy twice the size of China. We can pay for everyone's health care and everyone's college without blinking. In fact, that's an investment in America, paying for people's college and taking people's health care off their back, which then that money that she has to pay for overpriced health care system, she could then spend somewhere else, maybe buying housing or maybe
stimulating the economy.
Or stimulating the economy in other ways instead of having it be sucked out of the economy and go to the health insurance companies and the pharmaceutical companies, which is where they're going now.
We shouldn't live in a country where you're afraid to go to the doctor because you're going to go bankrupt if you do, right?
Yeah.
Like, I'm lucky in the sense that I have a good paying job, and I mean, it's a decent paying job, and I'm able to, save a little bit for situations where all of a sudden I'm billed $1,100 for a cancer screening, okay?
Yeah.
But not a lot of people are that lucky. So what do? They just don't go to the doctor.
Yeah.
Right.
And then they develop cancer and they die. So when we were having this whole affordable care debate, there was this whole notion of death panels, people deciding whether you live or die. That already exists to some extent, right? And the person deciding whether they live or die is the person who gets ill and who's too afraid to go to the doctor because of those bills.
Or a bureaucrat who says, I'm not going to pay for your treatment, which happens all the time.
Happens all the time.
First thing a doctor says when you call, or at least the office when you call, are you insured? What's your insurance? That's the first question they ask you. That's it.
That is the first question.
And before the ACA, if you had a pre-existing condition, they would say, no, I'm just not going to insure you.
Right.
You just got death paneled right there.
So I was just listening to this guy, Alan Watt. He's a philosopher. He's dead now, but this is from the 60s.
Yeah.
And he was talking about, if you talk to medical professionals, they say they spend a third of their day doing medicine and 2/3 doing paperwork. That's back in the 70s, 60s and 70s he was saying this. Imagine what it's like now. So I know that I had health problems for a couple years, and I remember my doctor would spend more time on the phone with my health insurance company trying to get my MRIs approved and everything else than she would talking to me and trying to work on me. So we get rid of all that when you get Medicare for all, and Bernie's correct. That's what we need. We need Medicare for all. He needs to say it that way. Why doesn't he say Medicare for all? That's what we need.
He used the term at the debate.
There was, when they were trying to make a compromise, remember, should we have the public option, should we not? Ben Nelson from Nebraska wanted to shut down any kind of health care. And one of the things they was presented was, hey, maybe we let people 50 and over buy into Medicare, and that's basically the public option. So that's what you say, hey, you want that's I think that's the first. He's trying to go too much.
You think he's going too far?
I think the people are fatigued from healthcare talk, right? And I think now he wants to upend it again, and he really does want to change it, but he wants to change it for the better. Obviously, it would be better than what we have now, but he needs to just say, we need to expand Medicare. So it's not a change. It's not that big of an upheaval. People can wrap their minds around, we're going to expand Medicare. People can wrap their, but now that whole thing of we're going to give single payer, that's still, people still don't know what the F that means.
Yeah, but after 4 years of talking about this plan, a lot more people will know about it than know about it now.
I'm just saying a better way to help
Whether this is the way to do it or not, I don't know.
Well,
there's a lot of different ways you could do it.
I think Jimmy has made two solid points, both
in
during
his career.
No, hold on.
I think so. I don't remember them.
Hold on. About Bernie Sanders' messaging, and it never really resonated with me until you said it, and I really realized it. It's the way he frames certain things.
Yes.
And framing does matter, because if you say that you want this Medicare for all system, if you want to do a complete redo of what we went through during the Affordable Care Act, that does discourage a lot of people, which is what Hillary Clinton was banking on
that.
during the debate. She kept talking about, we went through all of this to get the Affordable Care Act. Now you want to do away with it and start from scratch. That turns a lot of people off. So he does have to change his messaging, and he does have a better plan, if you ask me. Because here's the thing, no one's going to build off the Affordable Care Act.
No.
Affordable Care Act has been around for quite some time now, and no one has tried to improve it. They keep saying that they will, but no one's going to do it.
Right, it's been around for 7 years. No one's tried to improve it.
Exactly.
It's just
the foundation that we're going to build on. Okay, well then build on it. Hillary Clinton, you say that you've been wanting to build on it, then do it.
Yeah, add a public option. If it could have been added in the beginning, it could probably be added now.
Yeah.
I would be happy with the public option because then that would be a real competition. The problem is private insurance. We have a middleman in between the doctor and the patient that's supposed to give you money, but he has to take a 33% of the money that you're spending. So it's just extra money on everything, and we have no cost controls. That's the problem with the ACA, was there was no cost controls. So now we have controls to get rid of your pre-existing condition and to cover more poor people. There are good things to it.
Yes.
But it's still structurally flawed because it's based on a for-profit system that gives a lot of your money to the pharmaceuticals and the insurance company.
Yeah.
And he's right, but he needs better messaging. And I'm offering my services again, Bernie. A middleman in between the doctor and the patient that's supposed to give you money, but he has to take a 33% of the money that you're spending. So it's just extra money on everything, and we have no cost controls. That's the problem with the ACA, was there was no cost controls. So now we have controls to get rid of your pre-existing condition and to cover more poor people. There are good things to it.
Yes.
But it's still structurally flawed because it's based on a for-profit system that gives a lot of your money to the pharmaceuticals and the insurance company.
Yeah.
And he's right, but he needs better messaging. And I'm offering my services again, Bernie.